I rise today to introduce legislation to help seniors navigate through a complicated and often overwhelming healthcare delivery system. Because of the fragmented nature of our healthcare system, we often fail to provide patients, their families, and caregivers with the necessary tools, information, and support to both age well and with dignity in their setting of their preference, oftentimes their homes. I believe that if we provide patients with better information about advanced care planning in non-crisis situations, they will make decisions for themselves and their families that result in better care and a better quality of life. So today, I'm introducing the Senior Navigation and Planning Act of 2009 to help seniors and their families navigate through a complex system and to help them make informed medical decisions. My legislation would provide access to advanced illness care management benefit, that kind of benefit that does not exist currently in our healthcare delivery system. My legislation as well would increase the awareness of advanced care planning through a national education campaign and clearinghouse. It would also reduce legal hurdles to the enforcement of advanced directives. It would create incentives for hospitals and physicians to get accredited and certified in palliative care. It would increase compliance with medical orders and discharge instructions. Too often, a patient may leave a hospital and not do the appropriate actions afterwards, not follow the discharge information, and oftentimes then ending up being readmitted into the hospital or ending up with their healthcare provider not having the appropriate follow-up. We've got to make sure we put an end to that. My legislation as well would educate entities, including faith-based organizations, on advanced care planning issues. Oftentimes, an individual or a family, when they're dealing with end-of-life issues, will turn to their medical, not only to their medical personnel, but oftentimes to their priest or rabbi or minister. And we want to make sure folks in the faith-based community understand the challenges and opportunities that people have with advanced planning directives. My legislation as well would increase integration and coordination between the Medicare and Medicaid programs. Too often, these programs that both deal with seniors, their health care issues, and aging issues do not talk, cooperate, or collaborate. Collectively, these initiatives will create a more accessible environment for seniors to receive the care they need, when they need it, and in the setting they prefer. Let me be clear, this legislation does not deny or withhold services. However, it does recognize that overall health reform should include a thoughtful process that informs patients, their families, and caregivers on how to navigate and think through difficult decisions about when and how to pursue treatments at end of life. By enacting these reforms, we will begin to develop a culture in which all of us will have the ability to age well, with dignity, and again, in the setting of our choosing. I ask unanimous consent that my full statement and letters of support from the following organizations: the AARP, the Alzheimer's Foundation, the Duke University Divinity School, Institute on Care at the End of Life, the National Hospice and Palliative Care Organization, the United Healthcare, Aetna, and others, appear in the record immediately following my statement.
Without objections, ordered.
Thank you, Mr. President, and I note the absence of a quorum.
For the millions of Americans with Alzheimer's disease and related dementias, advanced planning is essential. And for individuals with end-of-life dementia, dignity and quality of life are really the key issues. And the Senior Navigation and Planning Act addresses those issues as early on as possible by providing individuals with dementia and their families the tools so that they can plan ahead as early as possible.
This is critically important in our healthcare debate, and we know from research that we can really train our physicians to do a better job here. And what Senator Warner's doing is helping to provide them the training that our physicians and nurses are telling us they need.